Reports show that 90% of Americans remain susceptible to COVID-19 despite the fact that the United States has the most amount of reported cases in the world. A disproportionate amount of those cases are here in Eastern North Carolina. I sat down with the health disparities expert to talk about those COVID cases in the East.
So, you would think with a disease like this that is so easily transmitted when you have large groups of people, that rural counties wouldn't be susceptible.
Dr. Ronnie Bell is the Associate Director of ECU Center for Health Disparities. He says our region's disproportionate number of cases is due to our area's workforce. Many people are in essential jobs.
There are a lot of people who live in Eastern North Carolina whose economic situations help determine the types of jobs that they have, and so they are working in environments like meat packing and processing.
Bell also notes many people in the East are at a higher risk of complications from COVID due to underlying health conditions.
Many of the counties in Eastern North Carolina have very high proportions of African Americans, Hispanics, and American Indians, and those populations are more vulnerable because of their higher rates of comorbid conditions like diabetes and obesity and hypertension.
CDC findings show cases aren't as high around beach areas, even though many tourists came to the Outer Banks and Crystal Coast for summer vacations.
There may be people who have traveled to those areas, but then, when they got back home, they were diagnosed, and so they would be the record of their diagnosis would occur in their home county.
With cases expected to rise, many people are wondering when a vaccine will be available. CDC Director Robert Redfield says that a vaccine may not be available until next year. For 9 News Side, I'm Victoria Holmes.